this.
All right, we are live.
All right, we are back after our joint session with the House on judicial retention. And we have, we've invited Steve Klein to come in to talk a little bit about the American Rescue Plan, get an overview of what joint fiscal has at this point. And so, Steve, thanks for being here. Greatly appreciate it. I know how busy we all are, but just a quick introduction to what joint fiscal has and understands at this point, and then we will be coming back to this probably more than once. So
Yeah, okay, I'm just trying to,
we
I'm
have your
failing
screen.
miserably at sharing my screen. So let me take a minute here to do this.
Steve, it is up there on our
It
screen.
is.
We can see
Oh,
it.
yeah.
Oh, you can see it and I can't. Okay.
That's what I said.
Oh, good. I'm sorry. So you see something that says Joint Fiscal Office, March 25th
Yes,
document?
yes, sir. Yes, sir. Yes, sir.
Oh,
Yeah,
I'm
that's
so
it.
happy. Okay. So that's really great. I don't see it on my screen, but that doesn't matter.
What,
so
wait.
What I was just going to do is I'll go fairly quickly, and you all need to stop me if I get incoherent or if you have questions.
Okay, well, I
So-
won't ask you to magnify it, but so
Okay.
we'll just look at it.
I can make
as
it bigger, maybe. Let's see how to do that. Is it getting bigger?
Yes, now it's good.
Yeah.
We've got the
Okay.
first page up. That's great.
Yeah, we'll do one page at a time. So
Yeah,
it's
good.
a lot of money. We think it's over $3 billion in this new bill that effect on Vermont. And that's not just going to the state, that's the total picture. And just to put this in a context, hold on. I have to shut up. Phone. When you think about the revenue forecast we did in January, it didn't really include this money or even the December 29th thing fully in the forecast. So when you think about this money coming into Vermont, it affects us on the revenue side too. So one of the things that as we think about this money is going to be much more longer term. It goes till 12/24 for 3 years. This is the good chunk of it. Some of it goes, well, different dates in different parts. But then it's also affecting our education fund and our general fund revenues in a very positive way. But one of the things to keep in mind is just like this money ends at a certain time, the impact on the economy, and it's not a permanent impact. This is going to be something that is going to balloon some of the state revenues, and then those are also going to shift downward. So when we think about it, we need to constantly keep in mind that this is a lot of money to spend for things that you can do now. And the biggest danger here is building a long-term obligation. So anyway, things are changing all the time. We've been told we're going to get our first regs, first guidance this week, but I'm not sure. $1 billion goes out at least to Vermonters directly, and that's the tax reductions, the 30% increase in ERTC, not having the first 10,000 of UI, taxable child care tax credit that's now going to go out monthly, aid to businesses and other individuals, the checks and unemployment supplement, premium assistance for healthcare. And that's a really interesting one because they're basically writing down the cost of the sort of healthcare plans only until September 6th. So it's sort of like you get people to pay less in healthcare for 5 months or so, and then I think the theory is then maybe in Congress there's a push to bring it up again in another bill, but it's a short-term thing. And then there's fund for SNAP.
That's for the ACA, that qualified health plans. It's not for the whole ball of wax. It's just for the.
Yeah, it's certain, there's income limits and things like that, but there are definitely, and also there's assistance for people that are on COBRAs and things like that. So
Yeah.
And we'll come back to this problem of timing on money and issues. I want to get into the homeless issue in a few minutes, but so the local governments, including about the December funds, we're looking at about 568 million going out to local governments and schools. And what I've got here for towns and municipalities in this bill, there's 197 million, 19 million for Burlington, and then 57 million shared between all the other towns. And I have the town by town data, an estimate of that if that's something you're interested in. But Then there's this 121 million of county money that goes to counties, but Vermont doesn't really have counties. So we've had a lot of discussions with the congressional delegation, and the thinking is that's going to go to municipalities also. There was some talk about, could we give it to CUDs? Could we give it to regional planners? And I think that the way the law is being interpreted is, and that could change with regs, but I would say the betting money is that's going to just go out and add to the counties. So when you think about Burlington getting 19 million of the municipal money and Calais getting 160,000, that's before you take this 197 million. And if we just added that, then you just take those numbers, multiply by, not Burlington, but you have multiply the other ones by 2.5. Burlington, I think altogether is more like 27 million. Burlington is the only city in Vermont that gets its own chunk, and cities that get their own chunk get more. So when you take the county money, we'll probably do it by population, and Burlington's share would be much lower. But it just gives you the towns picked out here are just random to give you a sense of what people get, and that's just sort of a concept here. Schools, state agency gets a 10% set aside. There was 114 million in ESSER 2, about the 257. I think it's gone in ESSER 3 for towns, and you can see the amount of money going to the state, the 12 and the 28. But when you start adding it up, that's 370 million just from those two, not including the ESSER 1 that already went out. That's money that's going out to towns that was not built in, or to school districts. That's not built into their budgets. It's totally not. They're going to have to figure out how to spend it. And one of the things, just as we talked about earlier, just as the state has an issue, these school districts and towns have to think about, this is not permanent money. The school money goes till 1023. And if you build a base on this, it's going to come back and bite us in the ed fund and tax rates. So one thing the Senate did in House 315 is they added 950,000 for the League of Cities and Towns and the regional planning group to provide technical assistance to municipalities on how to use the money and what to do to make sure they stay in the regs and they use it well. And it also proposed 2.8 million to UVM to possibly, it didn't say, it said UVM or some other vendor if they want, but primarily it can be sole source to UVM, like Tammy's outfit, to provide technical assistance to schools to figure out how to use that money and be within the regs, do good things with the money and make it valuable. So it's at least there's some technical assistance. And interestingly enough, there was nothing in the bill to provide technical assistance to towns or school districts. So we're taking a little bit of a risk by saying we're going to use the state money to fund that technical assistance. But I did talk to the congressional delegation, and they sort of realized they made a mistake. They should have done it, but it's the right thing to do. And so I think we'll be okay there. But those are the type of things that that are issues. So one of the things, just as we come to the state funds, and just since I'm on that, I'll say it now, is the general use of state funds you've seen in 315 and you'll see in the House budget is to look for things that are within the law, which are within the congressional, that we can find sort of something to tie it to. And then where we, once the regs are out, we'll be able to move money around or think about what we could and couldn't do and take more risks. But there's some areas that we'll go through that we actually just spent a little beyond what we think we can do. And again, the question is, and there are ways to deal with that. And we'll talk about that. So I would say the money support, technical assistance to the schools, technical assistance to the municipalities is, the schools are probably less so, because I think we took that out of the ESSER money, but the municipality money, it's got a little bit more risk than otherwise. It's in the more of a gray area.
Hey, Steve,
Yes.
can I interrupt with a question?
Yes.
This is Ruth. Why did we give the technical assistance money for schools to UVM instead of to AOE or the School Boards Association or something?
So these are good questions. And what we did is we talked to the School Boards Association. They're not, or the Superintendent's Association, and they're really not set up to manage this. They would have to sort of staff up. There was not a lot of, first of all, the way the language reads is AOE can decide to go out to bid. They can decide to give it to UVM as their choice. And there was a general thinking that AOE right now AOE is the only support entity, and they're doing it, there was a real sense in the Senator Probst that AOE isn't really, it makes sense to have somebody else in the field. And we ran it by Jeff Francis, for example, and we ran it by the superintendents, the school boards association. And I'm not sure either of them jumped at the chance they didn't jump at the chance to run a whole, major program to help 256 towns and do technical assistance. I would hope that if they do go to the University of Vermont, that they bring those people in and there's sort of combined effort. But it could have been done differently. It's just a question of who has capacity now, because this is already hitting, the money's hitting soon.
Right. I get that. I just want to make sure it goes to the right place in UVM, because UVM is not doing such a great job of managing their own money, let alone trying to help school districts manage their money. So,
I mean, the thinking was it would probably be Tammy would probably be the one running it, but
right. So
she's setting up a center.
There are little places in UVM that have the capacity. Maybe it's we don't want to send it to too high up in the administration.
And
I agree with Senator Hardy on that one.
It's a dilemma. I mean, there are really mixed feelings about how AOE can manage it. And there was a sense that for example, they put out a requirement, and that schools have to come up with a plan for how they're going to do their recovery by May of this year. Well, I got to tell you, a lot of the school districts are just getting people vaccinated, have no capacity to do planning. There was a lot of expectation. I wouldn't say they're really strong on technical assistance, AOE. And so there was a sense that people didn't want AOE to be doing it. This is the type of thing that, anyway, I'll leave it to that, and that's something you all can talk about.
All right. Sounds fair. Thanks, Steve.
Okay. The CRF, the guidance regulations on this is like, we are concerned that like CF, the regulations could be delayed. We heard there's gonna be some now, but this bill just passed. And one of the problems with the new administration, it sometimes takes 6 months before the people are in place to do the work. Like, we're just getting secretaries approved by Congress. And then they have to put their deputies and they have to put their people. So the whole question about, on one hand, you want to get these regs out, the guidance and regs out quickly. But the other hand is you want them done by the Biden appointees as opposed to leftover Trump appointees. So there's this whole question about, there's a good likelihood that, like what happened last year with CRF, it could be months where we get this, a constant series of guidance and revisions. And we just don't know. Then the next thing I was to say, timing. This money, CRF was a 6-month program. The state and local funds that come out are there till 2024. So 3.5 years. School is till 2023. The language says that on the 1.052 billion coming to the state, it will come within 60 days of the time the chief executive officer of the state requests the money. And so we think that's, he hasn't issued a request yet. So I sense is, let's say he requests it in early April, May, it comes in June, or before June. So that's just, it will come before the next budget year. What the Senate did in their House 315 is added language giving the commissioner the authority to anticipate receipts and start spending it. Because you want to get some out fairly quickly. A lot of the things you did in 315 are things that you want to start, like if you're going to do work on state parks, or if you're going to do cleanup, you can do that in the summer easier than you can do it in the winter. And so you want to get that money out before the season. And a lot of stuff like that, weatherization, you name it. Just concept here, phase of the pandemic, the CRF was in the early crisis. A lot of that money went out right away to sort of meet crisis needs. We're now coming to where we have some needs of crisis, but we also really have a lot of needs for planning for the future and the recovery. So that the fact that we have 3.5 years means a good chunk of this money will probably be held till next January to think creatively about how it can best be used to fund over the next 3 years. And
but again, the recovery is recovery. It's not adding on to the base. I mean, that's got to be a constant reminder. Yeah,
it's absolutely right. And how do we use this money to sort of create a better situation? Well, we can talk more about that. just to give you a sense, we're getting 1.052 billion in Vermont. We are in the country, number 2 in the country in how much money we're getting per capita. I mean, I think Wyoming beats us, but that's just really a function of population, because we have a small state minimum. We get whatever the locals get, you subtract that, whatever's left out of 1.25 billion is what we got. So there's really an unfairness in here. I mean, I realize we're all invested in Vermont, but larger states, this is not as big of a chunk of money. And those larger states, therefore, have a much more easy time getting rid of it, using it, because they have so many needs and so little, and the money is just not going to go very far. So that one of the things that we are, the fact that we can plan for the recovery, the fact that we can plan for the future and think creatively about this money is a function of, our where we are, but it's also a function of how much money we got compared to the other states. They may have a lot more immediate needs. So let me think what else. So we got 1.052 state refunds. We got 113 million of capital funding. It's 113 billion, but it's the same thing. 113 million capital funding. We have 352 million of renter assistance. And at the first reaction there, and that's a lot of money. I mean, again, small state minimums, 440 million of mortgage relief. The renter assistance initially was like, and it still is a little bit like, even the advocates are saying, this is a lot of money. We probably can't spend it all. And there's been a pushback on the nationally to the other, and our advocates, are obviously part of national communities. And, is this having a small state minimum for this renter assistance? Is that there's ethical questions, racial issues in cities, and having a place like Vermont get all the money. But so, there's a lot of anxiety about that. But where this really becomes critical, and you probably all know more about this than I do, the homeless situation is pretty serious. And we have this situation where before the pandemic, we had 400 to 500 people who were homeless, and we paid $4 million a year to deal with hotel vouchers and emergency treatment. Well, during the pandemic, we made it much more accessible. And so now we have 2,400 people involved in hotels, and of those 400 are kids. And a lot of those, and the reason we can do that is FEMA has been paying 100% of the cost and that the cost is in the neighborhood of $6 million a month, 72 million a year to cover that. Well, that's not FEMA will probably stop paying 100% once the pandemic moves out of its, really serious state. We sort of think by September, the FEMA money may not be there. And you can't, a lot of the hotels that we'll be using, there's some that we can use for this purpose for a long time. There's some that are going to want to go back to having tourists, and things like that. So that there's been a lot of, actually, we got a concern from a Middlebury hotel that raised a question about, we don't want to be planning to take these people in after a certain point. So there needs to be a really serious effort to figure out how do we get back somewhat along the lines of what we used to have. How do we deal with these? And it can't just be, the governor had put down a proposal, you may, again, know more than I do, about having the communities handle it. But that was sort of rejected in quite a bit of ways because communities can't necessarily handle this without a tremendous amount of support. But there needs to be something done. And it needs to not just be paying for hotels, it needs to be support services, and there needs to be a unified plan that really encompasses all of it. And so the good news is that the renter money can be used for this population. So that the fact we have all this money buys us time. So we can maybe cover the hotel costs out of the renter assistance. But we still need to shrink it. I mean, you cannot leave that. What we're finding is the amount of availability for a hotel and the amount of populations has led to increasing numbers. And we're in a currently untenable situation. So
a lot of thinking that's going to have to go on, and absolutely we had a crisis before the pandemic hit.
Yep.
With step down beds and support services, crisis beds, and so on. So it'll be, and there are plans out there with some of our DAs and SSAs, but and our mental health system, but I'm linking it up with homeless, period, that's going to be the trick. And then the other part of that, which we'll have questions about as guidance comes through, are some of our long-term care facilities and trying to make them whole. This is going to be,
Yeah, and you'll see some of that in the House bill about making them whole. And this is something where I think you're going to have to take, I would say when the Senate gets the appropriate budget bill, between the time the Senate gets the budget bill and the time the Senate reports that bill out, we're going to have a strategy on the homeless issue. So we're talking weeks of coming to some agreement with the administration, figuring out the next steps. So anyway, childcare, there's a lot of money in this bill for childcare. And so one of the questions that's come up, and not just for childcare, is this, just like education, is this really the time to sort of implement a new, a weighting proposal or a categorical there when they just got 380 million that's supposed to go to low-income Vermonters? And childcare, I think it's in the neighborhood of $40 million that came in. And just at what point do you use the federal money first and maybe add some money to try to figure out where the needs are, and so that you can target your own resources later on. And this will come up in a lot of other areas, like in the budget, the governor proposed doing an expansion of the downtown tax credit, 1.75 million. One of the questions, and I think the House is deciding that maybe this is not the year to expand the downtown tax credit because local towns have $180 million of their own, and they can do the same type of stuff. They can do that. They can do support broadband. They can support a lot of stuff. So part of it is just recognizing there's a surfeit of money now, and maybe we just you go through this money and use it and try to learn from it before we sort of allocate state dollars, because state dollars are at a premium. Okay, so now we get to the state funding. What the purpose of the state funding, this 1.052 billion. The key purposes, we only have 8 minutes. Oh my God. So are you at a hard stop at noon, or what's your thinking?
We could go on for like 5 more minutes.
5 minutes. I'll only take 5. Okay, I'll go really quick.
That's good. There you go.
I'll move to the rapid fire ones. Whoever's listening at double time will never be able to understand a word. Okay, so the key thing.
And by the way, this is now up on our webpage.
Right. So that the 3 uses that they say to respond to the public health emergency with respect to the coronavirus 2019 COVID or its negative economic impacts. And then there's a comma. Then it goes, including assistance to housing, small businesses, nonprofits, or AIDS impacted industries such as tourism, travel, and hospitality. So part of it is what does that comma mean? Is it really just everything else and those other things are examples, or are those other things like, oh my God, that's what you can do? So we're sort of assuming that comma really means something, but we don't know. Well, we have to see the guidance. And so we're interpreting that broadly. So if that gets interpreted really narrowly, we have a problem. Like, for example, we say that because it was negative economic impacts and it's assistance to households, like IT developments could be a part of that, because we're making it easier for people to contact government. We're making it easier for state employees, and it's a little broad, so that's just the guidance. Essential work, they did that, but there's other language that says essential work or salaries of up to $13 an hour. I think they're in a little bit different state than they're thinking about when they did that than in Vermont. But still, a provision for government services about revenue reduction, but we don't really know what that means. Like if it says, for example, if our revenue went down in rooms and meals, and so that's a lot, and our revenue went down in corporate a lot, but overall the general fund went up. So we have to figure out what they're interpreting for revenue reduction. We're waiting to see how it goes. That could be a 20 million or 100 million, depending on how the guidance turns out. And what's really great about this, if we get money through that category, it just can be used to replace provision of government services. Very broad. We can do a lot of stuff with that. Then it says you cannot use it for any deposit and pension funds, which made us really sad. And so what we're doing is we're using this money where we can use it and saving general fund for the pension fund issue. Then the who was I quietly make that thing go way away. Stand back. Let me get back to where I was. So then there's another 113 million for capital projects, and that's more general, no time limit. To carry out critical capital projects to enable work, education, and health monitoring. And in the House, the institutions bill put a fence around it, and they're going to spend 15. They're going to spend. They put some of it for the State House, some of it for judicial courts, some of it for clean water. And then one thing that before I get there, there is language in this, you can see bolded in D. We're allowed to use the 105.2 to make necessary investments in water, sewer, and broadband infrastructure. So those are like, you can do that. So there may be some guidelines, but you'll see the House put 150 million in broadband. They put 100 million into clean water. And those are probably the clearest way, but they may write back and create limits. We don't know. So all of this is a little vulnerable. The House created a $38 million general fund reserve that they just left in the general fund for the January. In case some of this stuff gets retracted, we can move general fund if we have to in VAA. But the other thing that's easily more likely to happen is between now and next January, we'll learn that you can take a lot of this money, like we with the CRF, and maybe put it into public health or put it into corrections or and do things that are eligible and free up the general fund and use that to cover the things that aren't. So I think the budget adjustment is likely to be a lot of money swapping, and as people figure that out. So let me think. The last thing I'm going to do. I'm still got 4 minutes. Then there's a detailed sheet here, and it just talks about what we know. And this is not complete, but this is as of March 12th. You can see some of the detailed money, and we really focused on the 105.2 fiscal relief fund on top, and then we just talked about the local money and the capital project money, and the school money. But then you get down here, childcare, 18 million development block grant obligated by 9/30/2023. Childcare stabilization grants, 29 million. So that's what, $47 million, and the entitlement, small money, but it's there. Head Start, energy assistance, and we don't know, for example, if this is going to be all we get or if this is an additional we usually get. We're still sort of finding this out. And so these are some of the breakouts. You can see the money coming in for supportive services, congregate home meals. And one thing that would be good to do, if you haven't already, is just bring in the administration and talk about how do they envision using this. This is not, some of this came in through existing, where there's already an existing line in the budget. It doesn't have to be approved by the legislature. It just comes in and just they can excess or exceed it. So we don't know a lot about this. We have not spent time in the fiscal office tracing it down yet. You can see some money in transportation, 6 million. I mean, 6 million is not, and then 800,000 in food and 600 here. That's library services, you name it. These are small numbers. In the olden days, this was big money, but now when you're dealing with $1 billion, this just is like, we'll get to it later. So the moral of the story is we're focusing on big things right now. There's a lot of money here. Use is unclear, and there's going to be a lot of work for your committee and for everybody to figure out what to do with all the other pieces that we haven't begun to hit. So that's it. I am so done.
Yeah, great. Terrific. So I'm looking at the 2.78 for mental health, and a block grant grant for substance abuse. This is in addition to public health grants that are ongoing. So this is
right.
The recovery piece. That's not a whole lot, honestly, but so that's like a drop in a bucket of need right there. That one.
Yeah, but we heard the same thing from Representative Lippert, that the 2.7 and the 5.4 was a drop in the bucket. That's $8 million,
Yeah, no, it's still a drop in the bucket. But but then the other thing that is almost invisible through here is, I did see it. I did see a line about it, but it's the healthcare recovery for our providers. So we had a very strong fund for providers during and after with a CRF, and is there anything in here that is explicit about the business of healthcare?
And so I think that, and I don't want to get too far out beyond my knowledge, but I think they get direct money that's not through us, but I don't know the answer to that question.
Well, the hospitals do, but not the providers. And
yep, so, that's a good question.
Yeah, and then the DAs and the SSAs are sort of scattered, maybe. So we're gonna have to do some work on understanding the regs, the guidelines.
The other thing you don't see here is they gave for home and community-based activity in Waverly, we get a
Yep.
10% bump in our FMAP, but for 1 year. So that's unfortunately it's a motivator to do the wrong thing, because you can,
Yes,
you want to spend money now, get a better match, but if you create long-term obligations, you're putting yourself in a vulnerable situation. Although we tend to think that's going to be followed up with some more support on the federal level, but it's just we are looking for ways to, and that may be an example where if you want to strengthen the institutions in the community, do it now on one-time support, and where you have a higher match. And we don't think this is one of the issues comes in. There's nothing to indicate this can be used for matching other funds. So we may have to save the general fund to provide the general fund share of the federal match. And so that's an issue.
well, no, it's interesting. I know we're over time a little bit, but it really is fascinating that there was so much concern about our municipalities not being supported during the pandemic, and now it seems like we're moving it. It's the whole issue of homeostasis. You know, we go from one extreme to the other. So
yeah, and it's the municipalities were very mad at us were mad at the Congress for not giving them anything last time.
yes, I know that, but now they are, and just we want to make sure that it can be balanced out, that other homelessness and other areas are taken care of. Oh, so go ahead, Jane, just go ahead, Ruth. Yeah.
Thanks, Steve. Is the bill that that's coming over to us, the child care bill, does that use any of this American Recovery Act funds, or that's
I
something?
don't think it does. And
Okay.
I think it may. The answer is I really don't. Actually, probably I see that
It's in the budget.
Jen is on the phone. She may have a better sense than I do about what that bill's got in it. They may have postponed spending state dollars a little bit because of the availability of these money. So one of the things, that's a good question, is how does this coordinate with the federal dollars?
Right, because I know that one of the things in that bill is actually tech. You know, their database, and that seems like a perfect one-time funding kind of thing.
Yeah,
so
I totally agree. And actually,
good idea.
The House spent $61.9 million on technology out of $100 million pot that they were holding for technology. And you may want to decide, we want to give some grants for technology.
And what about speaking of technology, the UI system? Is there any money that could be used for that to improve the tech?
I think that there is, I don't remember offhand what, but I think the House may have put some money into that in the budget.
Okay.
That would be something we'll have to look at.
Okay.
Yeah, the budget should be coming over to us pretty soon, and we can, and then maybe I think Katie's keeping an eye on the childcare bill, so she may have some insight in as to what the Appropriations Committee did with that funding.
Right.
Yeah.
I think the budget's up for second reading today in the House, I think, right?
Yeah, something like that. Steve, thank you. This is
no problem.
So now, we get very energized when we see something like this, and we have more questions and answers, of course. So
yeah,
we'll come back to it as there are more guidance documents out and more regulations that we can understand in our area. We'll dive further. Thank you.
Okay, thank you.
All right.
Okay. Bye.
Nellie, we can go off YouTube. I think we're ended for the day.